Let's talk about how systems communicate and understanding different styles of internal communication. Hi, I'm Sarah, licensed professional counselor in the state of Michigan, and I work with those who have dissociative experiences. Have you ever wondered what internal communication really means for people with dissociative identities? Maybe you've heard phrases like, my parts talk to me, or we have inner conversations, but what if that communication doesn't sound like a voice at all? Today, we're going to talk about the many ways systems communicate internally, how messages can come through, sensations, emotions, impulses, or image, and why each of these forms of communication, this form of communication is valid and deeply intelligent. Let's talk about what internal communication really is. Internal communication simply means that different parts of the same mind are sharing information. It's not a special skill, it's the natural outcome of awareness expanding inside a dissociative system. But here's the key. Communication isn't always verbal. For some, it feels like thoughts or conversations. For others, it's a wave of sadness, a sudden pain in the chest, or the urge to run. The body itself can become the language of the system. Let's talk about common styles of internal communication. There are many forms of internal dialogue, and none is more real than another. Let's explore a few common ones. Okay. Auditory or verbal communication. This is the classic inner voice, clear dialogue, distinct tones, or conversations inside the mind. Some describe it like hearing from the inside. Others sense words as thoughts that aren't fully their own. Emotional communication. Instead of words, there's a sudden emotion shift, joy, anger, shame, that belongs to a specific identity. It's a message saying, someone inside feels this right now. Somatic or sensory communication. This might be tension, tingling, nausea, warmth, or a sudden movement urge. Often the body is how parts who can't speak make their presence known. Talk about visuals or symbolic communication. Some parts send messages, colors, or symbols like flashes of a room, an object, or a memory. These visuals can hold meaning that unfolds over time, especially if you're in therapy. Let's talk about intuitive or knowing communication. A quiet sense of, I just know this, without clear words or reasoning. These impressions are often subtle but trustworthy when approached gently. Let's talk about why communication feels different for everyone. The way a system communicates depends on how the dissociation formed. If trauma happened before speech developed, communication may begin as body sensations or emotions rather than dialogue. If the system develops strong internal worlds later in life, parts may use more organized verbal or visual methods. Neither is better or more advanced. They're simply adaptations. Each system evolves communication styles that match its history and its current level of safety. Now let's talk about how to listen to nonverbal communication. When communication isn't verbal, we have to shift from listening for words to listening with curiosity. Here's how to practice that safely. Notice before you interpret. A sudden stomach knot may just mean something inside feels afraid. You don't need to decode it right away. Respond with kindness. Try saying inside, I feel that. Thank you for telling me. Track patterns. If certain sensations happen in specific situations, that may be how a part signals distress or boundary violations. Stay grounded. Remember curiosity over analysis. Interpretation will come when the system is ready. Let's talk about for therapists and supporters of those who have dissociative experiences. For clinicians, it's important not to pressure clients to verbalize internal experiences. Encourage sensory and emotional literacy first. What does that feeling in your chest want you to know? Verbalized insight can emerge later, once the system trusts that communication won't lead to shame or disbelief. We're not trying to make parts talk, we're helping them feel heard in the language they already use. Integration through understanding. What it's like to be present in your own life. As systems build communication, the goal isn't to translate every single signal into perfect words, it's to develop mutual understanding. Whether through language, sensation, or emotion, every form of communication is a bridge, a way for parts to say, we're here, we're listening. And that's what healing really is, learning to speak each other's languages. Let's do a little bit of reflection on what we just talked about. If your internal communication doesn't sound like a conversation, if it feels more like shifts, sensations, or images, that's still real communication. Your system is talking in the safest language it knows. You don't need to force it to become words. You just need to keep listening. If this video helped you understand the many ways systems communicate, please like, subscribe, and share so others can find trauma-informed information that replaces fear with understanding. And if you recognize yourself in this discussion, reach out to a licensed trauma-informed therapist who understands complex dissociation and parts work. Every voice, feeling, and sensation inside you matters, even the quiet ones. Just remember, listening isn't always with the ears. Sometimes it's with the heart and the body. Thank you.